Hello, welcome to Dr. Kelvin Nguyen again. Today I would like to talk about a disease that I have put a lot of interest in my early career. It's hepatitis B. This is probably one of the most common viral hepatitis in the world. Today, it has affected about 500 million people in the world. More common in Asia and in Africa than in America, but as you know, with immigration, migration, a lot of people here in the US also have the disease. This disease has affected in different ways. Basically, you can get it by blood or by having body fluid exchange. The most common ways people get it in the world is actually through vertical transmission. What does that mean? So vertical transmission means that you get it from mom to baby, and that is probably the most common way of getting it. Although nowadays with vaccine, with a lot of technology and drugs that we have nowadays, if we can give it to the baby within 24 hours, after being delivered, then the baby would have zero chance of getting hepatitis B from mom. So that is the good news. The bad news, which Kelvin had this conversation with a lot of patients in the clinic, is that we don't have a cure for the disease yet. At this point, we're working on getting what we call, basically we can treat it, we cannot cure it. Meaning we can make sure that the viral load in the bloodstream is undetectable, but it's not at the level that basically we call a cure, meaning you cannot get rid of it completely. They might linger in some other organs in the body, like the lymph node. They might linger in the liver, but in the cells itself, but you cannot detect it. They can linger in the DNA of the cells as well, and we cannot detect that very often either. That being said, even with the treatment, the success is, at this point, I would say, it's decent, but it's not the best. As you can imagine, there's a lot of money, a lot of research has been going on, pouring into this topic, and we're hoping in the next decade that we will be able to get rid of it, just like we did with hepatitis C, that we actually find a cure for the disease. So let me tell you this. Most of people, when they come to Kelvin with this condition, usually they don't have any symptoms. Very rare that Kelvin experienced that, somebody with a symptom of hepatitis B. Most of the time it's through screening, meaning that people go to their family doctors and basically they do a blood test and it's detected in the blood test. How would you ask your doctor to be detected? So pretty much if you have any first degree relatives that with hepatitis B and potentially you can be a carrier for the disease, then you need to be tested. That being said, if you have mom or you have dad with the disease, even though you were born in the US, for example, you get all the treatment, all the tests when you were born here, you should be tested anyway, because you might have lived in the same household with your parents. They have it, and they are carriers even though they don't have any symptoms, but you can still get the hepatitis B. One fun fact, hepatitis B is very, very, very resistant, meaning that they can survive outside for up to about 7 days. So you can imagine if Kelvin go play basketball or volleyball, had a drop of blood on the floor, I do have a chance of getting, or somebody else has a chance of getting hepatitis B if that person actually have a scratch on the body and somehow get in contact with that drop of blood. Sounds scary, right? And just to give you some kind of relativity, if someone have HIV, for example, the virus actually would be inactive after 24 hours outside of the body. So a lot easier to get hepatitis B just from being exposed with different mechanisms when you actually doing your daily activities. So now that you go to your primary care doctors and you get tested for it and you get positive for hepatitis B, what is the next step? You might have heard stories that I have hepatitis B and my doctor put me on medications. Well, the next person you talk to, they also have hepatitis B, but my doctors don't put me on any medications. So why is that? So the interesting part about hepatitis B is that, yes, you can be a carrier for the virus, but they might live in your body, they might live in your liver, but it doesn't do anything to you or to the liver, meaning it's just basically a passenger. Just they live in your body, they live with you, but doesn't do any damage. And in that situation, in medical terms, we actually call it immune tolerance. So if you're in that situation, then a lot of times we don't recommend the patient to get treatment. And the reason for it is, yes, you do have the virus, but we were hoping that at some point, your body has the ability to get rid of it for good. And that's what we were banking on. That chance is low. It's actually lower than 1%. So some patients might have the chance, and we don't want to take that away from the patients. For that reason, we do some more blood tests. If we see that you actually immune tolerance, we're just gonna check on you periodically, but we don't necessarily put you on medication. Now, if the decision is, okay, we did a blood test, we saw that you have hepatitis B, your liver test is actually high. We're talking about your ALT and your AST. If you have a chance to look at your blood test results, you might see that. So if that's the case, and it's actually pretty consistent, then the decision is to start you on the medication. The hope is that by getting rid of the virus in the bloodstream, Kelvin say only in the bloodstream, okay, meaning that it's non-detectable in the bloodstream. It doesn't mean that it goes away completely. With that, the immune response from your body would be very minimal, and hopefully with that, your liver enzyme will be low. So the key thing is we want to cut down on the inflammation as much as possible. We do know that with hepatitis B, with chronic inflammation going on, that will put you at risk for having liver cirrhosis. And of course, when you have liver cirrhosis, which many of the hepatitis B patients would have, then you would have symptoms from it. As mentioned from previous episodes that Kelvin's talked about, you can have swelling of your legs, you can have fluid in your belly, you can have yellow skin, yellow eyes, you get confused, your boobs can get bigger, even you man, or your testicles can be bigger. So many complications from liver cirrhosis. So we try to prevent that chronic inflammation process to happen by offering medication at that point. Now, this is the scary part of hepatitis B, and Kelvin say this with a very heavy tone, and the reason for that is Kelvin seen young people with hepatitis B developing liver cancer. One of my pre-med buddies, when Kelvin was in college, I actually met him again at UCLA, and later on found out that he actually developed liver cancer. It's a 12-centimeter mass. Kelvin still remember because walking into that room, didn't expect to see a friend, and I did, and I was the one that making that diagnosis of liver cancer on my friend, and he died a year later. We're talking about a 21 years old Vietnamese American diagnosed with hepatitis B that was not treated, and he actually did know he had it and developed liver cancer and died at 21 years old. So telling this story is just to emphasize the fact that hepatitis B has the ability of creating a change in your DNA by inserting itself into the human DNA and causing alteration of the DNA, and eventually with that process, people can develop liver cancer, liver mass from it. And that's very important because the guideline now from the ASLD, the American Association of Chronic Liver Diseases, recommends that for Asian men and Asian men after 40 years old and Asian women after 50 years old should be screened periodically and frequently for liver cancer. In my clinic, if I feel that the patient, even though they're younger than those ages, if there is any risk factor for potential development of liver cancer, I would do all this screening as well. For example, patient already on a medication, for example, and I do a scan, and I found that the active inflammation has been going on, and that is chronic inflammation and scarring, which is fibrosis. That's the term that Kelvin uses with my colleagues. And so if that's the case, I would do screening for liver cancer a lot earlier. If you have family history of liver cancer, mom passed away from liver cancer, for example, I would do early screening for liver cancer as well. So it depends from one person to the next person of what to do for this situation. So don't be surprised if you hear stories that your friends also have hepatitis B, but the treatment is completely different than yours. There are reasons for it, and so don't be surprised, and don't just go in and question your doctors and ask why am I not being treated the same, because every case is a bit different. Last but not least of this talk, I would love to talk about one of the technology that we use. I mentioned briefly about FibroScan in my clinic, right? That I use FibroScan as a way to figure out if someone has scarring in the liver. The whole process of inflammation from hepatitis B would lead to inflammation and scarring, and the technology of FibroScan is very similar to ultrasound. It's basically we use an ultrasound probe we put right here, right next to where your liver is, and we just press the button 10 times. It will come out with a number, and this number is basically a score, and with this score we're able to tell how much scarring going on, how much fibrosis going on in your liver, and with that we can decide where you are at risk as with cirrhosis, and that also plays a role in the decision of treating you or not with medication. I hope that I give you enough information about hepatitis B, you learn something from it, and the most important part is there are two things I want to emphasize. One is, yes, screen for it. If you feel you're at risk for it, if you have family members, especially first degree relatives with hepatitis B, or you weren't born in this country and you migrated from a higher incidence of hepatitis B, then you should get screened for it. Number two, if you do have hepatitis B, the most important part is to follow with your doctor closely. It could be with your primary care, or see your gastroenterologist or hepatologist, and they will follow you closely. The worst part is somebody feel fine, I feel fine, I have hepatitis B, then you just kind of disappear from your clinic, and a few years later you show up and now you're having evidence of liver cancer, right? You develop abdominal pain, you're losing weight, you're turning yellow, skin turn yellow, eyes turn yellow. You don't want that. You want to be active and get involved with your health care, and basically trying to take care of it as much as you can, so that it doesn't get to that stage that you come to see your doctor and we say, it's too late at this point, it's not much you can offer you because the mass is too big or it's already spread. And Kelvin has seen that. So I hope I make the message very clear to you, and you learn something from it, and I will see you next time in another episode that I'm probably going to talk about the cousin disease of hepatitis B, which is hepatitis C. I apologize if it sounds very windy today. I'm at a park. It's beautiful. It's a little cold. It's beautiful, but it's it's one of the things that Kelvin loves to do is just be outside, be outdoor, and so you will see most of my episodes. Actually, we film it outside for that reason. That being said, ciao for now. I see you next time. All right, you guys have been watching my YouTube channel of Dr. Kelvin Nguyen. If you really love what you're seeing, please subscribe to my channel. You can do it for me, or you can do it for the duck in the background. They will love it too. See you next time.